please subscribe and hit the bell icon so that you will never miss any video from Acuere Life Science Foundation. Dear students, today I am going to tell you about the effect of the pH on the transport of the drug. The first question will be there in your mind, sir, what is this pH? pH is nothing but the negative logarithm of hydrogen ion concentration to the base 10. See, my dear students, do remember most of the drugs are either weak acids or they are weak bases. The ionization of a weak acid is given by Henderson-Hasselbalch equation. What is this equation? For a weak acid, pH is equal to pK plus log of ionized to unionized drug. Do remember, this is very important. I am telling you that pH is equal to pK plus log of ionized to unionized. If you change the position of pH and that log of ionized to unionized, shift them, the log of ionized to unionized become negative and pK minus pH will be there on the right hand side. Now minus, that is the negative logarithm of ionized to unionized, is equal to pK minus pH. Am I right? Yes. Now if you don't want this negative logarithm, you can make it positive by changing the position of ionized to unionized. And this is how log of unionized to ionized is equal to pK minus pH. And this is the equation every student should know. Now, if you want to change further it, like it can be changed as, if you want to find out the pK value only, the pK value is equal to pH plus logarithm of unionized to ionized. But for the betterment, every student should note that pK minus pH is equal to log of unionized to ionized for a weak acid. And this formula everyone must remember. Now I am going to tell you a very important thing. Now our final equation is log of unionized to ionized is equal to pK minus pH. Now I am going to tell you the fact that suppose the drug is 50% ionized and 50% unionized. Naturally the log of 1 will be there. Log of 1 is equal to pK minus pH. Log of 1 is 0. And that's why pK minus pH is equal to 0. It ultimately means that there is no difference between pK and pH. In very simple language, when the pK value of the drug and the pH of the medium, when they are equal, the drug remains 50% ionized and 50% unionized. Now I am going to tell you some examples. The first example is the pK of the drug is 5 and pH of the medium is 4. Now according to our formula, pK minus pH is equal to log of unionized to ionized. Now pK value is 5, pH is 4, and that's why 1 is equal to log of unionized to ionized. Now we will take antilog of both. Antilog of 1 is equal to 10. This is very important. Antilog of 1 is equal to 10. The equation will be like this. 10 is equal to unionized upon ionized. What does it mean? It means that unionized form of the drug is 10 times more than the ionized form. All of you know that the absorption of the unionized form is faster. Unionized drug diffuses earlier. And that's why for a drug having the pK value of 5 and a medium is having the pK value of 4, the absorption of the drug will increase by 10 times. Now I will be giving you another example. Now the pK value of the drug is 5, but the drug is suppose in the intestine and the pH of the intestine is suppose 8. Now according to our formula, pK minus pH is equal to log of unionized upon ionized. pK value of the drug is 5 and pH of the medium is 8. Now it will come down to 5 minus 8 is equal to log of unionized to ionized. It means that minus 3 is equal to log of unionized to ionized. Now taking antilog of both of these, antilog of minus 3 is 1 upon 1000. It means that 1 upon 1000 is equal to unionized upon ionized. It means that the ionized fraction is 1000 times more than the unionized form. Naturally, in the second example, the ionized fraction is very high as compared to an ionized fraction, and that's why the absorption of the drug significantly decreases. This is all for the acidic drugs. Now, I am telling you about weak bases. Very important point I am going to tell you is that in the second equation, that is for the weak bases, the equation for the weak base is pK minus pH is equal to log of ionized to unionized. This is a very important change. In acidic drugs, it was pK minus pH is equal to log of unionized to ionized for acids. Now it becomes pK minus pH is equal to log of ionized to unionized drug. Now I would like to give you example. Suppose my drug is having the pK value of 9 and the medium is having the pH of 8. Now according to our equation, pK means 9 minus pH means 8. 9 minus 8 is equal to log of ionized to unionized. 1 is equal to log of ionized to unionized. Taking antilog of both the sides, antilog of 1 is again 10 and ionized to unionized will be there. It means that the ratio of ionized to unionized is equal to 10. Ultimately it means that ionized molecules are 10 times higher than unionized molecule. In simple language, when the drug is more alkaline, having pK value of 9 and the medium is lesser alkaline, having the pK value of 8, the absorption of the drug reduces by 10 times. Now we will take one more example. Here the pK value of the drug is 9 but the medium is having the pH of 10. Now according to our equation for the weak bases, it is pK minus pH is equal to log of ionized to unionized. Now the pK value of the drug is 9, pH of the medium is 10, 9 minus 10 come down to minus 1. Now minus 1 is equal to log of ionized to unionized. Again the same, taking antilog of both the sides. Antilog of minus 1 is equal to 1 upon 10. 1 upon 10 is equal to ionized upon unionized. It means that an ionized form is 10 times higher than that of the ionized form. It means that a drug having the pK value of 9 and the medium having the pH of 10, the absorption of the drug will increase by 10 times. This is the example of alkaline drug in alkaline medium. Now I am going to tell you what is the clinical application of all these pH issues. I would like to give the simple example of aspirin. Aspirin is having the pK value of 3.5. When we take aspirin, in the stomach it is going to dissolve and the medium of the stomach is acidic. All of you know that the acidic drugs remain unionized in the acidic medium. And when the drug is unionized, the absorption of the drug is faster. And that is how some aspirin will get absorbed from the stomach. It will move in the epithelial cell, mucosal epithelial cell of the stomach. Because medium outside the cell is acidic and the drug is in unionized form. And this is how it will move inside the cell. But what will happen inside the cell? The drug will become ionized. Why? Because the medium inside the cell is neutral. The pH of the cell of the mucosa of the stomach is 7. And that's why there will be ionization of this aspirin. Now think about the blood. the drug will remain in the cell and will not pass to the blood, because pH of the blood is further more alkaline, that is 7.4. And that is how the drug get trapped in the mucosal cell. The drug will be transferred from the stomach to the mucosal cell, but further from the cell to the blood it will not pass easily. And this is how the drug will remain in the cell for more time, causing toxicity to the cell, and is one of the important cause of development of gastritis and development of ulcers in the stomach wall due to the continuous use of aspirin. This is also known as ion trapping, because the aspirin get trapped in the mucosal cells of the stomach. Now we'll be talking about the pH of the drug and poisoning. My dear students, do remember the acidic drugs are better absorbed in the acidic medium and are better excreted in the alkaline medium, because in the alkaline medium the drug become more ionized, and when in the renal tubule the drug is in the ionized form, reabsorption of the drug will not take place and the drug will appear in the urine. In very simple language, ionized drug appear in the urine. Acidic drugs are more ionized in alkaline medium, and that's why when the poisoning is due to any of the weak acidic drugs, then alkalinization of the urine increases the ionization and excretion of the drug. Such alkalization can be bring about by the use of soda bicarb. In this situation, we use soda bicarb by IV route. On the other hand, there are certain drugs like morphine. Those are alkaline in nature. The alkaline drugs are better absorbed in the alkaline medium but are better excreted in the acidic medium, because when the drug is alkaline and the medium is acidic, the drug will remain ionized. When the drug is becoming more and more ionized, the absorption of the drug from the renal tubule reduces and the drug will appear in the urine. And this is how acidification of the urine for an alkaline drug increases the excretion of that alkaline drug. Then how this acidification of the urine can be bring about? It can be bring about by the use of ammonium chloride, or even vitamin C can be used for acidification of the urine. Do remember, high dose of vitamin C is required for this purpose. This is the clinical application of this concept of pH.